thoughts come from. Well, let me ask you a different question. What's going on in your liver right now? Hi, you have no idea, right? So some of you do because you probably drank too much last night. So you can say something bad, but I don't know exactly what it's doing. Well, the thing that you should know that's actually kind of creepy, but you should know, is that our brains are mostly liver to us. For some of us, chopped liver, like presidents, but they are it's a big chunk of neurons in here, and it's a functioning organ like any other. And we don't. I mean, kidneys. Anyone want to tell me what's happening in your kidneys? But what happens when you're asked a question like that is you try to answer it as best as you can. Problem is that as best as you can, you're basically making stuff up. And you don't know that. It doesn't feel like that, but that in fact is what's going on. So let me show you how I got to Tide. Before I do that, I'll say one thing. Did you notice I said the market share for Tide is a little above 40%? Okay? I didn't say it's 42.3%. The reason I didn't do that, and the reason why you should never give exact numbers, is because when you give exact numbers, what happens is people start to think about them with this part of the cortex. And that's not the part of the cortex that moves people, by and large. What you do is you distract people from your central message, which is, I wanted to get across the message that, hey, this is creepy, but I can get you to all speak in unison. When's the last time a bunch of progressives spoke in unison about anything? All right, so I want to show you how I did it. I said, I began with the word pair, ocean, moon. And what that did was to activate in our brains what's called a network of associations. That is an interconnected set of thoughts and feelings and images and values and emotions and memories, including things like remembering that your mom used Tide. But all of that stuff is at a, I said ocean, moon, so that rose up to consciousness. I then gave you the vegetable thing as a distractor, so that ocean, moon, none of these things would be in your consciousness, and none of you who were smart aleck, you were going to get, can I use profanity occasionally, or is this, that is all right. So for any of you smart asses who are going to say, wow, that was ocean, moon, I distracted you away from it. So vegetable didn't mean anything, again, maybe other than an occasional president. So what I did was I activated this network. So ocean, moon was at a high state. At first, it was consciously activated. Then when I got into vegetables, it was at a high latent state of activation in your brain, because I'd said it so recently. But then what I never said waves or tide, but that entire network got activated. And we actually know you're going to remember, not necessarily remember this experience or the words, but there is going to be a latent memory of ocean and moon that is going to be slightly elevated even a year from now, that is detectable in a year. And I'm going to show you in a minute why this matters so much on an issue like healthcare and any other political issue or issue that we are passionate about. So I said ocean, moon. Then I said laundry detergents. It activates another network, all, cheer, fab, shout, Tide, and something for you other neurologically troubled people. So now you have different associations. We'll get to that. So I said activated a second network of association. None of those things were conscious, but what does happen is if you look at the intersection of those two networks, there is one node on those networks which is doubly activated. That's Tide, and that's why it came up. Now I'm going to show you in a second the question. I'm going to show you why this really matters and why I began with this and why this really matters in the way we speak. I've heard this is a very immigration-friendly crowd. Is that accurate? Yes. Okay, so if you want in Q&A, I put this in and then took it out again late last night, or well, it was early this morning. But I can get back to it as a slide that includes a message on on comprehensive immigration reform that wins left, right, and center, that a number of us worked on in various ways in multiple iterations over 5 years. And the first iterations, we could only win by about 2%, like 59-49 against a really tough opposition message, which interestingly turns out to be the message that right now the president is using. Well, when he does switch, but his typical immigration message. Once after multiple iterations of testing, as you'll see, it wins better than 2-1, and it wins strongly with people, voters on the far right. So if you're interested in that, I'll show you. But you're going to be an anomalous crowd because of your interest, or maybe not. So let's have the first question. Does that show up somewhere? Oh, great. Well, we've already got answers to a first question. That's impressive. I must have activated some pretty strong networks. So the first question I want to ask you is, for those of you doing it, is a yes or no question. How many of you could tell us the name that DACA stands for? Okay. And then the second is, how many of you could tell us, well, we'll get to that question in a second. So, you want to, so are we ready, or how long does it take? You all set? Okay. Whoa, this really changes. Okay, you're not as remarkable a crowd as I thought, and you are an honest crowd, which is impressive. This is a huge problem in messaging, because we have people out there on television using the word, the acronym DACA all the time. People don't know what DACA stands for. I worked on immigration for 5 years on messaging. I have to think hard, and I can't remember what DACA is either. Well, first rule of messaging after round your numbers is never take your acronyms out in public. They are killers. They are not good, because for you, DACA means a lot, probably. For the average American, they're thinking, well, what the hell is DACA? I mean, it's something about the Dreamers. Well, that gets to the second. Let's get to the second question. So 2-1 said no, and this is a group of people who I gather are quite interested in the question. Now here's the second question, and similarly, be honest. I have to say you were wonderfully honest. So how many of you know what could tell us why Dreamers is capital DREAMERS, and what the DREAM stands for? Yeah, I see that dropping. Okay, so roughly again, about 2-1 in a group of people who are passionate about issues like this, you don't even know. Every time someone goes on television and says, oh, this issue of DACA and the Dreamers, they hear Dreamers and they're thinking, well, who the hell are they? I mean, you had to explain to them who Dreamers are. They're often referred to as so-called Dreamers by journalists and commentators because they don't know either. And the average person's thinking, well, what are they dreaming about? I mean, what are they going to sleep lab at night and having their dreams measured, or getting EEGs, or do they remember John Lennon singing, Imagine, and talking about I'm a dreamer? And I mean, it doesn't make any sense to the average person. Well, the reason it's capital DREAM, little ERS, is because DREAM Democrats in particular have a love for when they come up with the name of a bill, they want it to become an acronym. That is one of the reasons why Democrats are the vast minority of elected officials right now at every level, because it is the absolute wrong thing you want to do. Again, Dreamers doesn't activate any kind of emotion for people. It doesn't make you feel empathy for people. It does with this group, but that's because you have different networks activated than the average person does. So it's not a good term. So I mean, the first thing, frankly, this is amazing that so many years later, the Democrats still don't have this, but they don't have anyone who's testing the names of their acts or of their bills before they put them out there. I mean, think about George W. Bush for a second, who we're now thinking, God, can't we just get him back? George W. Bush, in a great irony, if you'll probably, those of you who are old enough to remember, I see a few faces out there who are as old as I am and remember, his first agenda item was education. And you know, he wasn't the most articulate president, so maybe it was he thought it could benefit him too. But you'll remember the name of his cornerstone legislation, which was No Child Left Behind. Now think about that for a second. No child left behind. Immediately you have feelings, right? I mean, if you hadn't known that was coming from George Bush, if I said that was coming from Barack Obama, you'd start to get tears in your eyes, all right? But you never heard a Republican ever say, and that's why I support NCLB or NC. You never heard that. And the reason you never heard that is because they have a frickin' message shop that tests their messages. And what they were told was, do not use the acronym because it's not powerful. Call it No Child Left Behind. And why do you do that? You do that because when your opposition then says, this is a bunch of adding a bunch of extra testing. This isn't helping the kids you said it was going to help. They say, what, you're for leaving children behind? You're stuck. I mean, you say, and this is the reason I'm against No Child Left Behind. Good luck on that one. So it means it forces you into the weeds. They're talking at the level of values. If we're not going to leave any children behind, you're now having to explain why it is that it really does leave children behind and why it is that you think something different would work better. That's a terrible place to be. Well, that's what we should have done on our side. And families and the Herndon Alliance worked really closely with Celinda Lake and me to do the messaging leading up to the 2008 election on healthcare reform. And we had multiple messages that won 70-30. And if the administration had just continued to use them, I'll show you the difference that it would have made. So let me give you some examples, and it's all based on networks. When I say the unemployed, that's fine. Again, you're activists, so you're concerned about it. It bothers you. But what you've just done when you say the unemployed is you have taken real people with pain-lined faces and you've turned them into a nameless, faceless abstraction. Here are these people who may have had to tell their kids, they had their home foreclosed, they may have had to tell their kids, sweetie, how to get rid of that? Thank you. It's almost time to restart your device. Okay with you if I hit escape to get rid of that and come back? I think we want to reschedule here. So, no, that didn't work, and it's not showing up on my screen. Well, in fact, my mouse is not showing up on my screen. Oh, there it is. Great. Well, let's just try going back to where we were and see if it goes away. Okay, hopefully it'll stay away for a little while. So let me give you some examples. So the unemployed, I mean, these are people who may have had to say to their kids, you know, I'm really sorry, but this isn't going to be your room anymore. How do you tell that to your kids? Okay? When you say the unemployed, you are literally activating the wrong networks of the brain. You're activating that conscious, abstract, rational stuff up here, but you're not activating any feeling. If instead you say people who've lost their jobs, or people who've lost their jobs through no fault of their own, how many of you just felt something? How many of you felt empathy? Well, you're a nasty crowd, only a couple of you. All right, so the difference between those two ways, well, I'll say it a different way. If ever you want to hurt a particular group of people or make them the enemy, call them the blank. All right? So if you say, for example, the rich versus the rest of us, which happens to be pretty apt right now. When you say the rich, no one's thinking about a kind rich person they know. They're thinking about this abstraction of a bunch of people who are getting more and more and more of what we produce in this country, and who just got a tax cut of around 15%, and who didn't have to work for it. We'll come back to that if we can. So it actually, just to drive this point home, when you say the unemployed, it activates this. When you say people who've lost their jobs, it activates networks up here that go straight to emotion circuits. The reason I emphasize, and those are, by the way, those are networks that evolved over millions of years in us, and there are similar networks, not for language, in other primates, but they evolved. Whenever you are thinking or feeling something about people, this gets activated. And you're more likely to have sympathy for them if you do, more likely to have empathy. The underemployed, that's a horrible term to use, and do not ever use that. Wipe that out of your vocabulary, because first of all, the average person has no idea who the hell you're talking about. What's the underemployed? Does that mean they're not working hard enough? Does that mean, you know, they figure, I'll work a half a day because, you know, my less than minimum wage job is really doing good things for me? No, that's not who it is. It is people who have to work 2 or 3 jobs just to put food on the table for their kids. Or you can shorten that. It's people who have to work 2 or 3 jobs just to get by. That is the underemployed. Now, why is that so important for this group? I actually put it in and took it back last night after I had dinner with an old friend of this organization, and mention that later. But the underemployed are a large percent of the people who are getting screwed in those 19 states that aren't doing Medicaid expansion. I mean, those are a lot of the people who we're about to hear people say, and starting to hear it now on the Hill, saying from the right, well, you know, we've got to have cuts to offset these they don't say massive tax giveaways to big corporations. So why don't we take it from people who are working 2 and 3 jobs just to get by? That's what you should say. You should say it all the time. Every time they talk about cuts to quote-unquote entitlement programs, by the way, wipe that out of your brain. Never use entitlement programs. Why? Because the unconscious network that gets activated around entitlement, what is entitlement? Have you ever met anybody who you feel was entitled? Do you like them? No. And you know, before I moved into politics, my main area of research was on personality disorders. And a lot of people ask me, well, how'd you end up moving into politics? I said, well, it was an easy segue. You know, it was difficult because I had to mostly emphasize narcissistic and psychopathic personality disorders, so it was limiting that way, but otherwise it was fun. But not fair to zillions of our elected officials and very fair to others. But the 5th criterion out of 9 for narcissistic personality disorder has a sense of entitlement. You never want to use that term. Knock it out of your vocabulary. Similarly, the unemployed. So every time you hear someone say, these are people who are, they're looking for a handout. They're looking for subsidies. We don't have the kind of money for a handout and subsidies. You simply respond, wait a minute. You just gave a big handout to every big corporation in the country. Of about 15% of their taxes got cut. And you're telling me that people who work 2 and 3 jobs, we better make them tighten their belts. Now you're saying something that actually means something to people. Medicaid recipients. I'll go through a few more of these. Let me just check on our time. We're 5:52 in 9:33. Okay, super. Let me go through 2 or 3 more of these. Medicaid recipients. Knock it out of your vocabulary. Why? A recipient is passive. A recipient is going like this. That's what you're unconsciously activating. So you don't want to talk about Medicaid recipients. You want to talk about people who rely on Medicaid for their health. Here's a rule of thumb. Anytime you want people to have empathy for people you're talking about, start with people who. Do not talk about dreamers. Talk about people who grew up in this country and they've never pledged allegiance to any flag but this one. Do you notice the difference between that, what you feel when I say that, when you hear journalists say, and these so-called dreamers, there's 800,000 so-called dreamers. I don't know what the hell that means if I'm the average voter. And why would they? I mean, because 2/3 of us in this room didn't know why they were called dreamers. ACA, ACA, universal health care. Knock them all out. Do not talk about the ACA. Do not talk about the Affordable Care Act. People don't know that's the same thing as what's popularly known or unpopularly known as Obamacare. They have no idea what you're talking about. ACA is even worse. Universal health care is bad. I'll tell you what we found worked really well 10 years ago. And then the administration forgot it, and now no one's using it. What we're really saying is that I believe in a family doctor for every family. That's what I believe we should have in America. They have it in other first world countries. We ought to have it here. And however we get to a family doctor for every family, we can have arguments about that, but that is something that most Americans, really high percent of Americans say, yeah, of course we should. But then the other side gets into, or we make the mistake of using words like, and this is going to make some of you upset, we use words like single payer. That activates to people socialism and a government takeover. That's what it activates in people's minds. If we say Medicare for all, I have something terrible to tell you, but anytime you use language that's like for all, or do people remember Hillary's campaign slogan? This is a problem. This is one. This, Mr. Comey and Mr. Putin are the reasons why Donald Trump is president. All right, because he had what's called in marketing a sticky message. A message that sticks. And I remember when the commentators first started talking about it, they said, it's a dark message. Absolutely not. The American people feel like the American dream has been stolen from them, and it has. They are correct. And so it was something like what? Better together? Stronger together. Anytime you use language about together or for all or whatever, you just activate it's one of those liberals network in the minds of swing voters, and you have just lost 15% of voters. So you never want to use that kind of language. We hear, of course we're stronger together. They hear, kumbaya, yeah, right. Okay. To keep going for just another few, the individual mandate. I mean, you can't come up with something worse than that. Why? Because you're saying, I'd like to control you. I'm going to create a mandate for healthy people. And I'm going to mandate that you spend a lot of money for unhealthy people. Does that sound good to you? The average person says, I mean, this group, yeah, I'll do that. But the average person says, hell no. Turn it around. Talk about it as a tax on freeloaders. Do we really want a bunch of people who think that they're immortal, think that they're invulnerable, they get appendicitis, they show up in the emergency room, and we pay for it? Have you ever been hit by a car with an uninsured driver? What happened? Your rates went up. That's what happens when somebody freeloads. Totally different meaning from the individual mandate, and people get it right away. DACA and the Dreamers. Again, I've already mentioned that. Talk about turning hardworking kids who love and serve this country into tax-paying American citizens. I can tell you that that phrase, turning people into tax-paying American citizens, is something that is incredibly powerful on the right. It's incredibly powerful in the middle. And for those of us who want to see undocumented immigrants who've been here for years be able to be tax-paying American citizens. We don't care so much, I mean, we do care about the tax paying because everybody ought to pay their taxes, but we're thinking citizens. But what people on the right are hearing is, all right, this isn't a crazy leftist. They're saying they ought to pay their taxes. And the reality is that, you know, if you're an undocumented immigrant and you're at the grocery store, it's not like when you get up, you know, most of us have sales tax in all of our states but two. It's not like you go up to the cashier and you go, hey, I don't have papers, and you have a fist bump. They go, all right, you don't have to pay taxes. And it turns out that about 2/3 of people who, in fact, are undocumented immigrants do pay some form of income tax, and it's often Social Security, which they will never get back. But you can't argue with someone who disagrees with you. I can tell you, I've done focus groups on this. So many of them, they'll say they don't pay taxes, and you'll say, well, actually, you know, 2/3 do pay taxes. It turns out, yeah, no, they don't. And then you say, well, those are figures from the IRS, and they say, no, they don't. Instead of trying to argue with them rationally and showing them the numbers, join with them and bring them with us by saying that just like the rest of us, they should become tax-paying American citizens. If somebody does what our parents and grandparents and great-grandparents did, and does their best despite the not knowing the language, to try to learn the language. No one wants to be in a country where they can't speak the language. The vast majority of undocumented workers are law-abiding citizens and law-abiding non-citizens. If they're felons, we don't want them here, deport them. But if they're honest, law-abiding people, they're obeying our laws. And if you add to that paying our taxes, if you say, so let's turn those about 10 million people who've been here for years, who've got kids who were born here, or who know no other country but this one, who played soccer with your kids and they didn't know it, you didn't know it. Let's have them do what our grandparents or great-grandparents did. Oh no. It's restarting. And that is it's back up again somehow. Oh, do you have that on a computer over there? Is that how you're doing it? Awesome, love you. Okay, so it is, yeah, definitely a round of applause over here. If you say, look, then this is the last line of that message that wins 3-to-1, 2-to-1 with any group you've got on immigration is so let's expect of people who've been here for years without papers to do what our grandparents and great-grandparents had to do, and that is do your best to learn the language, obey our laws, and pay our taxes, and so you earn the right to become a tax-paying American citizen. The average Trump voter goes, yeah! You are paying for what you're getting. That's where they are. I'm going to skip down. Let's go to the next slide, if you don't mind. We're going to skip that one too. If you can flip on this one. I'm going to talk about do I have a clicker up here? I probably don't. Oh, wait a minute. Do I? Is this thing functional? No. Can you click for me?
We do not have your videos.
Oh, you don't? So this is just hanging around. How did that move? Okay. Oh, it did come up. All right, great. Where do I aim this? Over here? Wherever I want. All right. All right. So, we're going to talk about three principles of effective messaging, and the first one is know what networks you're activating. And as I talk about that, I'm going to say something. I'm going to type in all kinds of crap that I've got to type in to get this thing started again. Let's start with one. Assume that the language you use is not going to be good with the public. Whenever I work for a client who's a nonprofit, I always say, you're not going to like this. But the best assumption that you should make is that the language you use is probably not, when we test it with 1,000 voters, going to rise to the top. It's probably going to go down to the bottom. And why? It's because if you're an activist, if you're an advocate, you have different networks than the average person. So why would you activate our networks instead of their networks? I mean, if you're trying to talk to people who speak in Spanish, do you speak in English? No, you talk their language. If you're capable of talking their language, and so. It is absolutely the same with messaging. This is almost coming on, and I'm just trying to remember what the hell that slide said. Okay, as the slide says, we have 10 minutes left. I'll come back to it if I can. Okay, so here's one. Never use the phrase, never talk about Obamacare. Here's why. Many of you love Obama. I understand that. Here's the problem. How many of you flew in here from another state? Okay, good number of you. Did you enjoy landing in Reagan National? That's why you never say Obamacare. Because what you are doing is you are turning off half the population right away. And it doesn't matter. The only president you could have done that with was FDR, because everyone loved him. I mean, he saved people's lives, and they palpably knew it. And that's why we had a progressive coalition for 50 years where the average person actually saw their wages and benefits go like this, and the American dream get fulfilled for so many people who were hardworking Americans. This is almost on. When you say Obamacare. Let me ask you another question. I would do it up here, but we don't have a lot of time. How many of you know who was president when Medicare was passed? Okay, fair number of you, and you probably would because you're a health-savvy audience. Oh, the update is ready. Thank you very much. No, I think I'll skip that. So you are. You may know, and now let me ask you. This one. Are you seeing anything up there yet? No, you're still seeing that. All right, let me see if I can get this back on. Okay, while it's working on it, Yes, okay. So let me tell you why you don't say Obamacare. Think about, imagine if in the late 1960s and early 70s and throughout the 70s and 80s, you said, oh yeah, I'm a senior and I'm just dying till I hit the age that I can get Johnson care. Not good, is it? I mean, you can imagine what the other side would say. They say, oh yeah, you go in for an inoculation for your child and they give them a shot of Agent Orange. That's not where you want to go. You are losing half the population by talking about Obamacare. We have to switch to a language that makes people feel something. And we have to switch away from the language of Obamacare that was created by the other side to spear it, to kill it. And it, in fact, immediately kills it with 50% of the public, which is exactly what you don't want to do. Principle 2, if you don't feel it, don't use it. Principle 3, tell a coherent story. Offer a narrative. So let's go to, we'll skip through, we've actually done this slide. Oh, except for one piece of it. All right. We're short on time. I'll get back to that if I can. Principle 2, if you don't feel it, don't use it. If it's emotionally inert, it is politically inert. If it doesn't make people feel something, it's going to do nothing in politics. Remember that. And it's got to feel this way to you. I would call this the Ella Fitzgerald Duke Ellington principle. It don't mean a thing if it ain't got that swing. All right? Those of you who are like me, old enough to remember who Duke Ellington and Ella Fitzgerald are, cognition and emotion co-evolved. They evolved together in our brains. Reason provides a roadmap for us. Passion makes the motor run. And try to get far in neutral. You can't do it. And we try to get far in neutral all the time, which brings up another great example, net neutrality. Boy, does that make me feel excited. I'm for neutrality. Really? Did a project for the Ford Foundation. Don't call it net neutrality. Call it freedom of the internet. Call it internet equality. Put in some values in that term instead of, oh, I'm for net neutrality. It's like something, oh yeah, that's a term for geeks. All right, here is the progressive's fallacy. Is that there's somehow telling the truth and speaking in an emotionally compelling way clash with each other. In fact, they don't at all. Let me show you an example. We've got this axis is how emotionally compelling it is. This axis is how true it is. First quadrant is a demagogue. Lies told really well. Okay? We've seen those before in history and not so far back. Okay? Then you've got quadrant 2, which is lies told poorly. But, we have to watch out because using our networks, we often think it's poor, but to the average person, it may not be. Now you get to progressives. Third, truth. You've got truth told poorly. And that is strong ideas, weak candidates, and you can have the best policies in the world. You will never see them enacted. And we've seen that over and over and over again. And someone needs to write a book called Why Progressives Can't Learn. Because this is true not only all over the country, but all over the world. What is good messaging? Good messaging is truth told well. Truth told in a way that makes people feel something. I believe in a family doctor for every family. I don't think that any child should have to worry about getting to the doctor. I don't believe that any parent should have to choose between paying their deductibles and after they've taken they've taken their kids to the doctor, get prescribed medicine, they have to choose between paying for their deductibles and paying for dinner. There is something really, really wrong with that. That's what you want to speak about. Was that a lie? Not the truth. Not at all. I mean, that's why we passed. I'm not going to use it. I wish I could show you these clips, but we don't have time because I do want to get to the end. start wrapping up. All right, so using facts badly, we'll skip over that. If we can come back to any of these, we will, but I want to make sure we get to the third point, and that is tell a coherent, memorable story. This is something that you do all the time, I suspect, in your daily work, but we do, by and large, terribly. We are a storytelling species. If you look at the great monotheistic religions, Judaism, Christianity, Islam, what you see is how are their holy books written? They're written in parables, written in stories, because you remember them. And it was only 5,000 years ago that we developed literacy. We've been around about 100,000 years as a species and have survived pretty well. We did it through stories. Don't share your fact collection with people. They're really not interested in it any more than they're interested in your stamp collection, okay? Don't give them your 10-point plans, because they're not going to remember past number 3 if you're lucky. Turns out, by the way, never go past 3 on anything. You want to share your values with people. Let me give you an example. What conservatives always do is they talk about values. They talk about things like, we're going to hear it now. These people aren't working and they want to take something. Might want to talk about the 2 months that their CEOs get off and they're not working and they're taking something. They just got 15%, 14%. But don't say 14%, say about 15%, because it's close enough for jazz. What they always start with is their values, and if they get around to it, they talk about the issues, and if they have ever even thought about it, they get to the policies. This is why they run for office well, and they govern poorly, okay? We don't ever talk about our values on the left. You should lead with your values. So if you're wanting to talk about progressive economics and why people should be with us, I am wrapping up, I promise. Start with use the tax act that just passed. What is it about that bothers us? Is that the average person right now is getting nothing from what's been happening with productivity rising. The Dow Jones is nothing but at this point, for the average American, it is an index of exploitation. The higher it gets, if you're not in it, if you're not in the market, which most Americans are not, yeah, the economy's doing great, but you aren't. What you notice is that the jobs that have come back after 2008 have come back without benefits at half the pay. That's what you know. So why don't you say to the average person, instead of talking about, here's an example. I believe that we should have a $15 minimum wage. The second you do that, they're thinking, well, why should it be $15? And why shouldn't it be 10? Or don't start there. Start with something like this, that I believe it's time to return to the days when you could put in a hard day's work and get good American pay and benefits for it. That's where we need to return. That's why I believe we have to raise the minimum wage to $15 an hour. Because if you count out 15 times 40 hours a week times 50 weeks, you get up to about $30,000. You want to try to raise your family on $30,000? That's if we raise it to $15. That's why I believe in minimum wage. I started with my values and I moved down rather than the other way. So I actually am getting towards the end of this. Remember that issues are subordinate in people's minds. Always lead with the values. Whoever defines, I'll skip that. I'm going to show you the structure of an effective message, and then I'll wrap up by showing you the structure of why we won on policy and lost hearts and minds in 2009 and 2010 on healthcare. First thing you need to do is you need to connect with the person you're talking with, or I'll talk about voters, with using something aspirational statements, using shared values, which is key. Then you raise concerns. describing the problem in ways that are ways that are vivid, and end with a hopeful solution that brings you back to those values again. So here was how to lose millions of votes by saving millions of lives. No one but Democrats could pull this off. I mean, this is an amazing feat. All of these people who got covered, there's 10 million people covered now who didn't have coverage before. They go, I hate Obamacare. And then they go, and they go to healthcare.gov and they get their Obamacare. Stop calling it Obamacare. Here's how they did it. The Republicans thought, we're going to get killed on this. And Frank Luntz wrote a famous memo that got leaked, and he said, look, we're not going to win on this, but I'll give you the best I could do. And I wrote this back in end of 2009, beginning of 2010, not from reading Frank Luntz's memo. It took me 5 minutes based on just listening to the news, okay? And if you don't believe me, I published it in the Huffington Post at the end of 2009, beginning of 2010. Here was their message, and it builds on their brand, the Ronald Reagan message, which is no longer so effective, by the way, which is a good thing. But it built on that idea of government, when it meddles with things, all it does is it gets in the way. We ought to have small government, low taxes, parentheses for the rich, because it'll trickle down, and a strong military. Okay, here it goes. The Democrats want a government takeover of our healthcare system because they believe government bureaucrats know better than you do about what you need. They want to put a government bureaucrat between you and your doctor. They'll set up death panels, boards of bureaucrats, to make up rules for when you live and when you die, and they'll decide which babies born premature with birth defects are worth saving. Because there's only so much money to go around, they'll raise taxes on the middle class and they'll cut Medicare benefits to seniors. You can see where this is going. This is a really coherent narrative. About 90% of it is untrue, but it is a really coherent narrative that people hear and they remember it. They go, oh. So, you know, something like death panels. You know, this is really relevant now because when we get hit with stuff all the time, we have to be able to fight back. And we're not as effectively fighting back as we could. When they said death panels, do you remember that from back then? All right. I remember hearing so many of us progressives say, that's stupid. Nah, actually, it wasn't stupid at all. Because they were activating fears in a lot of people about the fact that there is a finite amount of money to go around, and they were worried about this government takeover. Well, start out with this. Look, we already have death panels. They're called insurance companies. You just answered them. That would have been the end of death panels. When they said, they're going to put a bureaucrat between you and your doctor. You say, actually, I've already got one. It's my health insurance company. Ever tried to call them to get something paid? Good luck. Okay, I'll stop now with here was the Democratic message in 2009. 46 million people don't have health care in this country. That's no good. We need a story that appeals to the middle class. Okay, scratch that. Costs for the average person are rising out of control, so we need to cover 46 million more people while cutting costs at the same time. That's a little hard to believe. Okay, doctors should stop giving unnecessary tests because we've all had the experience of having our doctor foist on us unnecessary tests, haven't we? Try this. We should tax the really good plans that some working people get from their employers because we don't want working people to have really good plans. But we need a public option because it's essential to creating competition in the health insurance market. Okay, maybe not essential. Maybe a co-op. We shouldn't really have a public option anyway because congressional Republicans don't like it, and we have to have a bipartisan solution even though voters thoroughly repudiated the Republicans in the last 2 elections because true virtue lies in fixing failed ideologies with new ideas. And health care for all is a moral imperative because I'm talking to an evangelical audience today, and our internal polling says they like that kind of thing. I mean, this is what you heard. You did not hear a coherent narrative after the election. So to wrap up, I can't. I won't wrap up quite the way I was going to say, but I was supposed to wrap it up 10 minutes ago anyway. So to wrap up, the average American has no idea who you are. They have no idea that you're convening here today. They have no idea how many times you've convened and how many times how much time this organization, Families USA, and all the organizations that many of you work for, have been fought for 30 years to get something in place. We laid a foundation. That's what we should be talking about. And when you lay a foundation for something like we did, yeah, it's got leaks. So what do you do when the foundation has leaks? You plug them. You don't take a jackhammer to them. Well, what the Republicans want to do is what conservatives want to do is and the president and the Republicans in Congress say they want to do is they want to use a jackhammer to get rid of 10 million people's health care. Well, that's not what I believe. It's not what you believe. And I'll conclude by saying, even though the American people don't know who you are, though they don't know how we're fighting for them, I'm going to thank you for them, because your tireless efforts over these years have paid off and are going to continue to pay off. It's going to take continued tireless efforts to do it, but we are going to get to the promised land. Thank you all very much.
Thank you. That was awesome. Thank you, Drew. We could listen to you all day. Unfortunately, we don't have all day, so we appreciate your presentation today.
Yeah, that's why I don't have a wife anymore. She said the same thing.
We are going to take questions from the audience. We have some mic runners who are going to, if you have a question for Drew, you want to ask him a question, raise your hand. Our mic runners will get you a microphone. But I will jump in with the first question while people are getting teed up. A lot of conversation this week has been on Medicaid work requirements, the waivers. How do you suggest we tackle that? What is the best messaging around work requirements?
Okay, so here, this is one I can't tell you that this is one I've been thinking about a lot. I actually was thinking about it a little bit last night. On this one, what you don't want to do is to get into the weeds. What conservatives are great at doing is flying at 14,000 feet with their values. People ought to work if they're going to get anything. And you know, most people say people ought to work for a living. I mean, I don't believe that people shouldn't work for a living, you know, but they're using it, of course, to activate a stereotype and it's a stereotype of people of color, and it's unconscious. It activates that, and immediately they're thinking, yeah, they gotta have to work. Right. The best way I think on this is really, I think we need to have the broader message be, you know, first of all, what you're talking about is you have cut off healthcare in these states, whatever. If you're in one of those states, you've cut it off to millions of people who are working 3 jobs just to get by. And that what you're hearing from the president of the Republicans is that what we have so much money that we can give 15% tax break, hundreds of billions of dollars this year alone to big corporations who are really suffering right now in this economy. But somebody who's at the edge trying to survive, let's knock them off. You know, their health care is just too expensive for us to cover. All it would take would be knock 1% off of that tax cut, and you've got everybody covered.
Okay, that's awesome. Does anyone have a question? Okay, right here, straight ahead of us. Oh, I'm sorry, there. Here's the mic is coming.
I got a mic here.
Oh,
I got
great.
a mic here while we're waiting.
Okay, great.
Great, hi.
Thank you.
Where are you?
Right
With
over
everyone existing
Got it.
in their own media bubbles these days, do you have a suggestion about how to carry the healthcare message and get it outside of the bubble that so many people are listening to that is kind of self-validating?
Great question. Really good question. Because people who believe one thing listen to one news outlet or go to different places on the internet. People who believe the other go to the other. A couple of suggestions on that. One is we need to develop and really quickly test, and I can't emphasize enough. You know, I just gave you off the top of my head what you might say about work, but that might fail. I mean, I'm usually pretty close because I've tested about 1 million messages now with about 100,000 people on different issues. I'm usually close enough for jazz, but that may not be right. I do think framing it in terms of, Ronnie Pollock and I were talking about this last night. If you frame it in terms of the broader issue of we're giving they're wanting, Donald Trump and the congressional Republicans want to give everything to the rich, and they want to, and the rest of us are getting screwed. That's the message you want to keep coming back to this narrative. But, now I just forgotten what the question was.
Just people are in a bubble.
Oh, okay.
And how do you message to audiences?
So what I was trying to say is that you have to, first thing we ought to do is we ought to do what the Republicans do, we ought to do what conservatives do, and that is test their messages.
Yeah.
Have them, develop them, and actually test them. But how do you get people out of your bubble? Two ways. One is you speak in the language of their kitchen table. You don't speak in the rarefied language of social determinants of health or even health disparities. People really don't know what you're talking about. And if they do, you are activating unconscious images of people of color to them. And when you're fighting on grounds about people of color, you always want to make them conscious because our better angels on race and ethnicity are our conscious values. That stuff that clunks around is not good. So speak in a language that people remember. The other, I'll skip it. Okay, go ahead. Okay. I'll use you as my external monitor.
Okay.
A lot of us are starting to work on outrageous prescription drug costs, unaffordable. Give us a quick message frame for prescription drugs. I heard a little bit of it.
Yeah, that's also been a big issue.
Okay, and this is one that I think we can really win on. The American people, there's a handful of people who are villains. I should have said, one is politicians. By the way, if you're talking about the other side's leaders, you call them politicians. If you're talking about your side's leaders, you call them leaders. It activates completely different networks. People are really, if you say a CEO versus their worker, people really, really don't like that CEO who, and especially if you say, CEO's just cut himself another $3 million bonus for this year. Well, that takes $3,000 out of the wallets of 100,000 of his workers. Nice, huh? Or 1,000 of his workers. So they are good targets. Health insurance companies and pharmaceutical companies are the best targets we have for narratives. So the easiest way on that one is simply to say there's a really easy way to solve this problem. The first way is that we have the biggest consumer union in North America. It's called the United States government. And they should be working for us, not the pharmaceutical companies. And what they should be doing is when you go and when you buy a card, you just say, okay, I'll take that. No. We have to do what we did with the VA. We have to negotiate prices with them and say, no, you want to sell it at that price? We'll just buy it from Canada. And you have a back and forth with them, so you make it fair to them because they've developed the drugs, but you make it so that it is fair to us and so that our kids are not dying because we can't afford to pay for it. If you talk that way about it, it is really difficult on the other side. Remember, fly at 14,000 feet with your values, make them get into the weeds.
That's good advice across all of our issues. Is there anybody else who has a question?
Question over here. Can you talk about competing values? So fear versus empathy. Fear is just so powerful. So I understand your messaging, so we all do the values. How do you really counter? Because it seems like fear trumps everything.
Okay, fear well done, and I don't mean that in a moral sense. I mean that in an effectiveness sense. fear well done does in fact trump empathy most of the time. It is actually great to see that 85% of Americans now believe that those hardworking kids who love our country and serve our country let's turn them into tax-paying American citizens. That 85% say, yeah, let's just do it already. And that was not the case years ago. I just lost the question again.
It was about messaging on fear.
Oh yeah. So there's the most important thing you can do with your messaging is to make sure you build multiple values into it that cut across the political spectrum. I'll give you an example from a project with Robert Wood Johnson Foundation, where we actually we took on the question of how do you talk about health disparities. Well, here's one of the ways you do it. If you don't say, let me say it this way. Begin by saying this: everybody ought to take personal responsibility for their health and the health of their children. Everybody on the right is with you. Now, by the way, always start your messaging on something like this: start right and move left. Do not start left and move right. Because I can tell you from doing lots of online dial testing where people are moving, or listening to messages, moving these back and forth, and I'm seeing dials go up and down. As soon as you start left, you lose all those people on the right and they're gone. So you start with, look, you have to have, parents have to take personal responsibility for their own health and for the health of their kids. Then comes the next sentence. You've got everybody with you. You say, but you know, in a city like Detroit, it's just starting to rebuild now, which is great to see. But in a 100-mile radius, there was only one grocery store 5 years ago. Maybe there's 2 now, and 30,000 convenience stores. What does that mean? It means you can want to feed your kids all the nutritious foods you want, but you can't do it. So, yes, parents ought to take personal responsibility for their health and the health of their kids, but we have to give every parent the opportunity to show personal responsibility. That message kicks ass with people on the right because they hear, personal responsibility is a value they love. It has negative resonance with a lot of people here because they took control over it on the right, even though we all believe in personal responsibility. But you have to move from personal responsibility to give people the opportunity.
Right.
Yeah.
Okay, we want to get to as many questions as we can.
Okay.
Phil, would you like to ask a
That's
question?
nicely
I'm sorry.
done.
Yeah,
Phil
real
needs a
quickly-
microphone.
Real quickly,
in front.
when there's an actual flaw or a problem with your side, like the Affordable Care Act and people who make more than 400% of FPL, right? If you're an in-person assister, you know exactly what's wrong with this thing. How do you talk, and if nobody on our side of the issue is addressing what's wrong and what needs to be fixed and improved, then we just give up the argument, right? I'm in a blue state, but a very red part. So I'm dealing with this every day, and there's not much coming on the national front. Like, how do we address the real flaws with the Affordable Care Act?
That's a great question. The first thing we should do is we need to address the real flaw in messaging coming from the Democratic Party, which is focused solely on what they're doing and not what we would do to fix it. And it's an enormous mistake because a lot of voters in 2018, certainly 2020, are going to see the broken system because they're breaking it, and they're going, well, look at what the Democrats did. That's not very good. Here's a way to go. You don't go for every specific issue, but what you do is you start like this. You start like, look, with that foundation. We laid a good foundation for this, but a foundation has leaks. We want to plug them. They want to take a jackhammer to them. And I'll give you an example so that there are parts of the country where people only have, at best, 1 or 2 choices. Well, you know what? We believe that people ought to have a lot of choices, including at least one choice that the insurance companies don't get to control. So if the insurance companies want to keep hiking their premiums, if they want to keep hiking their copays, you go for it, but we're going to allow people to buy into Medicare as an option. And we'll see how those insurance companies, what they do with their premiums, what they do with their copays, and whether a little healthy competition helps them out. And so you take an example, any example you want like that of the fix. Don't get into it deeply, but just say in this case, remember that phrase, by the way. We believe in more choices, not more, including at least one that the insurance companies don't get to control. People would really, really resonate with that.
Yeah. Phil, would you like to ask a question?
I'd like to hear your thoughts on something that I'm deeply puzzled about. I've had the opportunity of hearing you several times, and each time I walk away, yay! But progressive candidates, by and large, don't seem to be using it. They're not stupid, most of them. What's the disconnect? How come you haven't succeeded?
It's a good question.
Tall order, Drew.
No, actually, I appreciate your asking the question because I haven't. And I went in about 10 years ago and found myself suddenly, after writing this book, The Political Brain, people, I was advising presidential candidates and stuff, and it just sort of bypassed city council and all that kind of stuff. And I was speaking to the Democratic caucus of the House and the Senate all the time and giving them, working for great nonprofits like Families USA and giving them messaging. And they would have the same reaction. Members of Congress would say, oh, God, that's great. They were writing down furiously and all that kind of stuff. And then they'd go out to their communities, they wouldn't use it. So what I learned is what I should have known as someone that did psychotherapy for 25 years. And that is that the first 2 or 3 times you talk with somebody about something that they've been doing it the opposite way for years, you have to keep doing it so that by the 151st time they go, oh my God, that applause line really worked. Thanks, Drew. And that's what has to happen. But what really has to happen is the conservatives have message shops. They have the American Enterprise Institute. They've got the Heritage Foundation. Mm-hmm. We do not have anything that is as strong that's comparable on the left. Mm-hmm. The Democrats do not, for example, have a centralized messaging machine where they can say, wherever you are, these are the best messages. Pick from among them the ones that you could tell in your voice. Why don't we do what Newt Gingrich did and start arming candidates? They're driving all over states and districts, arming them with tapes. I mean, in our case now it's MP3s or whatever goes on you want on your iPhone. Right. But why aren't we arming them with tapes that say, here's the general issue, here's how to get to it, here's how to get to 14,000 feet, so that we get the advantage that is key to messaging, which is candidates hear it over and over and over, and gradually it creates networks in their brains. And that's the best. Yeah. That's the best way to do it.
I think we have time for one more question over here. Oh, Shelby. Oops.
Hi. Thank you very much for your presentation. I have one quick question. We foresee an attack on hardworking immigrants that fall in hard times and having to access benefits, even temporarily, coming up the pike. How would we handle messaging around why it's important that they have access to the safety net?
Okay. The first thing to do is to, and it's a really tough question because it's a hard one to answer. The first thing that you have to do is we have to get the language, any third-person language about them and they out of our messaging. Mm-hmm. When you speak with someone, don't make it a them. Make it a, these are people who. So start there. Second is that the place we ought, the second thing you want to do is to control the narrative of who them and us is. And you say, look, we have, how many million people is it who still don't have coverage? 30 million? Mm-hmm. We have 30 million citizens who have the same problem that you're talking about a small number of people have relative to that. We need to solve that problem. We need to stop giving tax cuts to the rich and big corporations, and we ought to take care of our people, take care of ordinary, hardworking people. And if you're talking about people who are working hard, who are contributing to productivity in America, knock off those tax cuts to the rich, and let's take care of everybody who's living in this country. That kind of message, again, you go back to 14,000 feet. You go back to our values. I would just add. Yeah, we'll add one more piece. I'll leave it.
All right. Well, I think we have to wrap it up here, but I know you'll join me in thanking Drew for sharing his insights and his advice for us as advocates. So thank you, Drew. We really appreciate it.
Thank you. Good job. Thank you.
Thanks.
All right, at this point, we want to invite up the executive director. I know you guys had a lot of questions, and we didn't get to cover all of them, but obviously this is something we want to continue to work on. And I want to call up next our executive director, Frederick Assassi, to talk a little bit about where Families USA is and the way we're going to be working going forward. So, Frederick.
Ooh. Oh, I like that music. Thank you very much. All right, guys. So thank you. Can we give Drew one more round of applause? What a terrific job he did. I just said to him, he must feel a little bit like John the Baptist because he's out there, in the wilderness saying, guys, let's get disciplined. We got to get this right. So it's fantastic. So this won't surprise you, but I would say the most common occurrence for me and for many of the leadership staff at Families over the last year or so has been questions about, well, we've got new leadership at Families, and where are we going as an organization? So this is just going to be a very brief conversation for all of you so you can get a sense of the work that's been going on over the last year to help us think about how we can really hone and focus our work. And I want to just emphasize this. Our work, the very core of our work, we believe, is our support and our collaborations with all of you. So a lot of the thought has been about how do we make sure that we can evolve and become, sort of maintain and increase our relevance to all of the incredible work that you guys do on the state and local level. So let me start by saying, let me go ahead and put the slides up. Yeah, thank you. It's a very brief presentation, don't worry. And then at the end, I'd like to go ahead and call up some of our new leadership so you guys can see their faces. Many of you have already worked with them. But I want to give you a sense of the incredible talent that we've gotten to come to Families. So let's see. All right, so this is our vision for who we are as an organization. We've identified our 4 core focus areas, our 4 pillars of work. The first is, of course, coverage, something that Families is so well known for and something that we've sort of been the stalwart leader for the last 35 years. The second is health equity. You saw some of that work on display yesterday during the plenary. We believe very strongly in this work. We believe in elevating it to the core of our organization, not just a side issue. Healthcare value, and this is really about leveraging all of the work going on around the country that attacks the question of how can we get the U.S. healthcare system and our resources as a nation to embrace the needs of consumers, the needs of the most vulnerable, and then consumer engagement, which is really about, as you guys know, and I think especially for the assisters in here and all the folks working on the state and local level, as you know, there's a narrative being told on the national level about what people want, how they feel about what's happened, for example, with Obamacare, and then there's the reality. And boy, those two things are disconnected. And what we're trying to do is really elevate the stories, the life, the realities that people are living in to cut through all of that rhetoric. These are our 4 core capabilities, capacities, the resources we bring to bear in our work. The first, and the one that we're most proud of, I have to say, is our partnership and consumer engagement. This is our work with all of you. This is the 37 years of one-on-one, year after year, collaborations and hard work with all of you, getting you the information you need, helping to seed many of the organizations around the table, around the room, helping to find funding for you guys, do everything we can to support the incredible work you're doing on the state level. I'll talk about this in a second, but we have a lot of new folks at Families, including myself, who have done a lot of work on the state level and really believe in this power. So we're very excited about the incredible resources we have at Families and growing them. Second is policy. This is something that we're incredibly well known for. And we brought some amazing new policy talent. And as you guys know, we have some of the best in the business already. So this is about one thing, which is culling through the reams of federal regulations and the bills that are being dropped in Congress and the bills that are being considered on the state level, going through all of that and finding what are the most important things to highlight on the national level and the state and community level to make sure that people understand what's happening, can activate, and can make sure that the changes that are occurring are good for us, for our families, and for the most vulnerable. Next would be government affairs. And government affairs, as you guys know, families has a very privileged role, particularly here in DC. We are one of the most beloved organizations to progressive members of Congress, to progressive administrations. I would say there's an amazing interchange. Often many of our staff have been working like myself in leadership positions on the staff level in Congress or in the administration, coming back and forth. You'll hear more about that in a second. But this is really about the fact that we have the ability to really influence and collaborate with folks who have our same fight, who are fighting to ensure that the best health and healthcare are equally accessible to every single person in our country. And then last but not least, communications. And this is an incredibly important role that Families has played for so long. As you know, what would be better than what Drew just talked about? And this is thinking carefully and having a lot of discipline about the way that we talk about our social justice movement. How can we influence people? How do we take everything that's happening and give you guys the tools so that you can take that message to the state and local level and really make a difference? So this is our theory of change, our theory of work, which is really important, as I've talked about. We want to bring together the national, state, and local triad. We really believe, you know, first and foremost, incredibly important work is happening on the state and local level that is actually impacting millions of people's lives, and we want to be there with you to help you in your struggle and your work. But then we want to take that work and elevate it into national dialogue. And as you guys know, you know this when you walk into state legislatures. There's no better way to influence somebody than bring somebody back from their home district or state and say, this is what we need, this is what's going on, this is an example of what the people of your state want you to support. Same thing with the administration, right? So we want to be able to bridge the disconnect between what's happening on the state and local level and the national level. We've done that for decades. Many of us in leadership have had a lot of experience doing that work, and we're excited to really amplify that and bring all of you forward. So let's talk just a little bit about our four core focus areas and some of the work that we've got underway right now at Families. So coverage, really simply, the way we think about coverage is to ensure that all families have comprehensive and affordable health care coverage, period, end of story. And obviously, this has been, we were just quantifying all of our work over the last year, and it won't surprise you to know that 50% of our work this past year, just a little over 50%, has been focused on this one issue, protecting the gains we made under the Affordable Care Act, the same fight we've all been in together, CHIP reauthorization, Medicaid, all the defense work around Medicaid, and both on the national and state level. So that's a big, big part of our work. But I want to tell you, we've got some amazing new talent at Families. We'll be introducing him in a second, but one of the individuals is a gentleman by the name of Stan Dorn. Stan's done a ton of work on the national level. He's right here. And he's also done a lot of work on the state and local level. And I am not understating this, he's probably one of the most creative geniuses in the country on how can you take existing law and statute and use it for the good of the people, and how can you make changes that will be good for people. So he's been doing a lot of work around things like how are states going to adapt if because the individual mandate has been removed from federal law. How can we leverage the interplay between actuarial values and subsidies to, I think the term that Stan told me is silver. Say again? The silver affordability fee. So this is a really innovative idea where we can take those premiums and actually create a new, more affordable and high quality product for state residents. Things like the basic health plan option and many other issues. And this is about sitting in that middle place between all of us that are the advocates and our governors and their governors' leadership, and bringing us together to figure out how we can make improvements, not just play defense. And then another really, really important part of our coverage work, as you guys know, is oral health care. And I haven't talked too much about my background in oral health care. I've worked on it for decades. It's something I believe really deeply in. I believe it's about not just policy, but also cultural change. As a nation, we have to understand that the health of what's going on in our mouths influences everything in our bodies. And for folks who've worked in really underserved communities, the nexus there is incredibly powerful. So I'm really proud of that work as well. Next, we have health equity. And we talked about it yesterday, but this is really, in a nutshell, to ensure all families face no barriers to living a healthy life because of who they are, where they live, or how they identify. And the task force we announced yesterday, the Health Equity and Payment and Delivery Reform Task Force, is focused on bringing together two of our core pillars, equity and transformation and value. But it's about leveraging leveraging all the transformational activities afoot around the country to say, this is what's good for the most vulnerable in our country. And by the way, these other transformational efforts that are underway are hurting people. We talked about it yesterday. Really proud of that work. It's very, I think, forward-thinking, and it's way overdue. The Community Health Worker Collaborative, something we've been working on now for several years. This is about ensuring that there's true financial support for community health workers that are working on the ground who are really making a difference for some of the most vulnerable. Very proud of that work. And then we also are looking very carefully at consumer engagement, which is the last one on this list. But consumer engagement, as I talked about, is about elevating the voice of the people who are impacted by the policies being considered here in DC or on the state level. We have a couple really interesting projects going there. As many of you know, we have probably the foremost, most respected and sought after story bank, storytelling program in the country. We don't talk about it a lot because it's not really about families, it's about the families and the people that we bring forward through it. But we are the go-to resource from leadership on the Hill, from the administration, to find people who can come forward and tell their stories. We also are very active in litigation, finding plaintiffs to challenge laws that are being passed or new regulations that are being promulgated. And then finally, healthcare value, which is really what brought me to families, as I've talked about. I've done a lot of work on the provider level, and the federal level in Congress, and then, of course, with the governors where I came from. And what I saw was when you get it right, the reforms are incredibly powerful. Things like housing is healthcare, right? We can show governors and other leaders that there's so much waste in the system, and if we just redirect some of those resources, we can change people's trajectory, and we can save them money, and we can create a more efficient system. And it's about finding those places where we can bring together that strange bedfellow set of within a coalition and really make a difference. Things like ACEs, adverse childhood experiences, right? Finding the ways in which early in a child's life, they start accumulating experiences that then put them on a trajectory that lasts for an entire lifetime. It's things like the opioid crisis, which is something I did a ton of work on at NGA, finding the ways in which we can bring together our public health resources with our health insurance resources, with our law enforcement as public health, not as enforcers, right? And really make a difference and save people's lives. So that's an example of the work going on. There's a lot more to talk about. We have an amazing prescription drug program going on right now. I know every time I hear somebody talk about prescription drug pricing in this room, there's at least 3 or 4 people who start applauding wildly, which I love. You may not know this, I'm sure you do, because it's the same thing on a state level, but there's very few organizations out there who are not severely conflicted when it comes to pharma. Pharma does a great job of investing in everyone, and then everyone's sort of very nervous about getting involved. We do not have a conflict, and we are very excited to take this on. It's a tough issue. So with that, there's lots more to talk about, and we are thinking every day about how we bring in new projects that can really make a difference for all of you. And I really encourage, one of the things we're going to be doing over the next year is reaching out to a lot of you for feedback, input, to help shape the direction that we're going in. So please wait for the email, the call, and please get engaged. Let me go ahead and start calling up staff now so you can just see who they are. The first I'm going to call up is Lisa Shapiro, who you just met in the last session. Lisa, come on up here. Lisa is our new Chief of Staff and Director of Children's Policy, and her role is to oversee strategy, policy, partnership relationships, and organizational issues with the goal of advancing our mission and increasing the impact of families' work. Lisa has 20 years of experience working in public, nonprofit, and private sector on federal health policy issues, and with a particular focus on children. She's come from an amazing organization, First Focus, which you guys know very, very well. And she's brought her passion and her deep commitment to children's issues to families, and we're very excited about getting more and more engaged on issues impacting kids. As the Director of Children's Policy, Lisa applies her expertise as a child advocate and policy expert to bolster families' engagement. She also has extensive experience working on the Affordable Care Act, as well as public policy issues affecting children like childhood asthma and environmental health concerns. So that's Lisa. Next, I want to introduce a gentleman who needs no introduction, Patrick Willard. Come on up here. Patrick's not just great with a bullhorn, he also is our Senior Director of Partnerships and Consumer Engagement for Families. He oversees the team that is laserly focused on moving healthcare initiatives forward in the states and on the local level. And of course, he also is our giant brain, our inspiration, our master of ceremonies for this wonderful conference. He brings more than 25 years of experience with state and local governments. He has quite an interesting background. He served as a senior policy advisor to the mayor of Nashville, a chief of staff to Tennessee House Majority Leader, senior legislative assistant to ranking members on the U.S. House Ways and Means Committee. So he's got a lot of experience, and it's wonderful to have you here, Patrick. And then I'd like to bring up Dr. Elliot Fishman. So Elliot is our Senior Director of Health Policy at Families. In this role, he leads Families Policy Strategy, working with Policy Department and other members of senior leadership. He brings 20 years of experience working to promote health policy innovation and universal coverage, both in government and in the private sector. Many of you may know this about Elliot, but Elliot was the person in the Obama administration you had to go to get your 1115 waiver approved. And that's actually how Elliot and I met. We were negotiating waivers, transformational waivers for governors. And Elliot, I was helping the governors negotiate. Elliot was helping the Obama administration negotiate. And as you can see, we found a kismet, a shared mission. So we're thrilled to have him here. Obviously, he's very engaged in our defense work around 1115 waivers that are happening around the country. You may very well see Elliot on a couple witness stands and some trials. He's helping people think through the history of these waivers and how we can push back against terrible policies. Elliot also led the Medicaid Children and Adults Health Group. He has years and years of experience and expertise, and it's a joy to have him here. And then I'd like to bring up Cincy. Come on up here, Cincy. Cincy is our Director of Health Equity and leads the organization's efforts to advance health equity and reduce disparities in healthcare across healthcare access and quality. She's worked in the field of health policy for over 15 years, and she's advised and represented 2 Puerto Rican governors on federal health and human services policies. She was a senior health policy analyst at SEIU, and she was also their national campaign coordinator. And Cincy comes, as you guys know, with brilliance, with passion, with an amazing ability. She has such an amazing connection to the community and to the national leaders, and it is a true joy to be inspired by Cincy and to have her lead our health equity work. And then I'd like to bring up Dee Manahan. Come on up here, Dee. And Dee has a terrible problem with migraines with bright lights, so this is an awful situation for her. So just stand in the shadows, Dee. Dee is our Director of Medicaid Initiatives at Families. Dee is a living legend. She has been at Families for a long time and is an amazing Medicaid expert, and she's deeply passionate about the program. Her work focuses on federal and state Medicaid issues, working with advocates from across the country to ensure that states take up and effectively implement the ACA's Medicaid expansion. She's been very, very busy on all of our Medicaid 1115 waiver defense work. She's also got a lot of expertise around Medicare Part D, prescription drug programs and access, and global health. And prior to Families, she was a partner at the Lash Group healthcare consulting firm. And it is a true joy to have Dee here in a leadership position. And last, but certainly not least, is the indomitable force that is Stan Doran. Come on up here, Stan. Stan is a senior fellow at Families USA, coming from, this is no understatement, being a true living legend at the Urban Institute. I have worked with Stan for decades. I tell the story all the time, but we were fighting incredibly hard, and I have to say this with Bruce Leslie in the room, because he was the guy who started all of us on getting the Immigrant Children Health Care Improvement Act passed. And in that whole effort, it's true. We also were working very hard on a provision called Express Lane Eligibility, which is about making it super easy for kids and others to get enrolled in programs. You qualify for one, you should be able to qualify for the other, right? Super simple idea. We had to take this to a floor fight. And we had Grassley yelling and screaming against us on the floor. And I remember sitting in the Reed suite on the phone with Stan, and I was banging out talking points, and it was maybe like 10 o'clock at night. And I was like, Stan, he's going to say this. What should we say? And we were just working it together. So Stan is both passionate and dedicated and brilliant, and it's great to have him here. He is widely seen as a leading national expert on some of the most complex and important healthcare issues facing the nation. We talked about many of them earlier. I think the way to think about Stan is he's going to help us all figure out ways to make whatever the current law is work as best as possible for our healthcare consumers, particularly on coverage issues and prescription drugs. But then also, he's going to be an amazing resource to think about how we can change existing law and regulation to work for families across the country. Stan has worked at both the state and federal level for more than 30 years, typically focusing on low-income and vulnerable populations. He's done things like streamlined enrollment provisions in the ACA, federal payment rules on basic health plan program, Express Lane we just talked about, state fiscal relief for Medicaid, health coverage tax credits, and legislation preserving Medicaid for families losing cash assistance under welfare reform. So that is our amazing new team. Let's give everyone a giant round of applause. Thanks, guys, very much.
So we'll be going to workshops next, and following that, we'll be coming back into this room for the awards for our Consumer Health Advocate of the Year awards, which we have 5 of them this year. So it'll be a special treat to see all 5 of our award winners. And so we'll be coming back into this room for lunch, but go ahead and get to your workshops right now. They'll be starting in about 15 minutes. So get to your workshops.